Hello again, everyone. Dan Bachman here. It's time for an update, and it is Friday, which means pink scrubs. I don't know why I always wear pink on Friday. Crazy Friday, right? It is January the 19th or 20th. I'm not even sure. January the 19th or 20th. And we've got some updates. Got some good news from scan results. There's also a question that I want to answer. I think I can answer this question a little better today than I have in the past when I've been asked it so many times by you guys and just other people, and talk about the plan going forward. So real quick, scan result, before I say this. So I also started a TikTok account. So this is brand new for me, but I've been told many times by many people, smarter people than me, that I should start one. And when I looked into it, I really liked the idea. So that is going to my TikTok, and you'll find it at Dr. Dan Says. Just like this YouTube account, it's just DRDAN, Dr. Dan Says on TikTok. That is going to be a place where I keep all my quick tips that people can apply right away if you're dealing with pain anywhere. Neck, shoulder, knee, back, hip, foot, ankle. I'm going to be putting a collection of all the stuff that has worked best for me and my patients here in clinic. Put them in little short videos that are easy to follow along and see if they help you. So there's going to be a big focus on low back pain, just because that's like the biggest problem in the world when it comes to moving parts problems. But I'll also do some just useful injury. Should I use heat or ice? All that kind of stuff I'm going to put over there. So go check it out. I look forward to seeing you guys there. Now, first of all, for updates from last time, I think it's been a couple of weeks since I last chatted with you guys. Had another CT scan, chest, abdomen, pelvis. Good news, no new growth. Okay, so obviously I want tumors to shrink, but job one, before that happens, I want them to stop growing. So that has happened. So not only did my CT come back good, meaning no new growth anywhere, including the pancreas, which is the big one that we care most about. No new growth anywhere over the last, whatever it's been, 2 months or something. All my labs are coming back better. So I think I may have mentioned to you last time that my CEA, which is a tumor marker, it's a little bit of a lagging indicator, but it came back 40% lower than it was before. It's still high, meaning there's still tumor stuff that's perceptible in the blood, but it's come down, I don't know, by a significant chunk there, which I'm all about, let me tell you. Now the other thing is all my other stuff, hemoglobin, all my other blood works. Hemoglobin, my sodium, which has been an issue for us, potassium, red blood, all the stuff that they measure on me, which is a lot. It's all trending better or sitting and parked in a good spot right now. So I couldn't be happier about that, unless things came back smaller, right? The other thing is that I've been feeling better generally. So I've had some bouts, which you guys may know from me talking about it before, bloating, constipation, malaise, just not fun stuff, which I've attributed to the trametinib, which is one of the 2 medications I'm taking, because it's a known side effect, constipation and gas pain and all that stuff. So I found that I can manage that pretty well using Senna tea, which is, I use one called Smooth Move tea. But Senna is just it's a leaf that occurs and grows in nature, and it acts as a natural kind of move things along agent. So I'll take 1 cup of that a day, kind of as needed. If I notice, I'm feeling a little bit of, like things aren't a little bloated maybe, that's when I'll take it, clears it right out and keeps things moving. Right now my belly's nice and flat, but I've had bouts of that off and on. It looks like I'm figuring out how to manage that. So also last time we talked, I've got back on the trametinib, which is the one. It's crucial because it cuts off this key pathway that tumors can use to get around the immunotherapy I'm on. So the immunotherapy is the trial, and then they're combining it with this other known chemotherapy agent to help make the trial drug even more effective. And so that's why I opted to stay on the trametinib, even though it does have these side effects that I've mentioned before. The rash is another one. I don't know if you can see, but I've got the rash on my chest and upper back and everything, and it's in my scalp and stuff. Again, it's not as bad as it has been, and they gave me some prescription like steroid cream to put on my face, and then the rest of me too to kind of manage that, keep it under control. So as long as I don't start looking like a leper, or even a leopard, the cat, spots everywhere, like I was before, I'm okay. I did let my folks know at the trial clinic that this is a thing. It feels manageable now, and I'm a good, I don't know how many weeks I'm into this new, resuming the trametinib on a lower dose. So we started with 2 milligrams first, we're down to 1.5, which still is effective. They said even if we drop to 1 milligram on the trametinib, it still can be effective cutting off that pathway that the tumors like to go around to bypass the other one. So still effective even if we go a little bit lower, but I'm gonna wait and see at this dose. The other thing we were worried about was heart function, because my MUGA scan, which measures ejection fraction, which is the left ventricle's ability to how much blood it can push out, that had been dropping in a bad way when I was on the trametinib before at the higher dose of 2 milligrams. It is improved when I got off the trametinib. I'm guessing we're going to have another MUGA scan down the road to see if this new lower dose is allowing my heart to work well. But I can say this, I'm not having the breathlessness or fatigue like I was having before on the old dose, at least yet. So I'm very encouraged about that. And sleep, I have been mega focused on sleep. I gotta say, I know I've said it before, that's the key element, that if I get the sleep right or as good as it can be, all the rest of my day is better in every way. I mean, from bathroom trips to energy to digestion to fatigue to brain working well, all those things improve with my sleep. So I'm averaging 10 to 11 hours in bed per night. I'm experimenting with some things to help me with sleep. As soon as I find one that's good, I'm definitely going to tell you guys about it, because I know sleep is a big issue for a lot of people who don't have cancer, but especially with it, because either you have the interruptions from your night, which I typically have about 5 or 6 interruptions for bathroom trips per night. Interruptions, so then that means you're up and down, every couple hours, which is my situation. So that means, yes, you may be in bed for 8 hours, but you're getting up every couple, so your sleep gets interrupted. You don't get to the deep sleep, you don't get to the REM sleep, so you don't get the high quality sleep. So my workaround so far has been to just spend way more time in bed. So even though the quality overall isn't great, I'm accumulating more sleep, and I feel noticeably more rested. So I've got a few little special tricks that I'm experimenting with to see which ones work best. As soon as I figure out what works best for me, I'm going to pass it along to you, so you can look forward to that. Now, I also wanted to address a question that I get. I know that I have attempted to answer this a couple of times, but over and over, and it's a surprise to me too why my attitude seems so good throughout this process, right? Because I mean, I would have never guessed that, before I had this diagnosis, that I would be as happy and excited and just champing at the bit and ready to go every day, like excited about each new day. I would have never guessed that. I would have thought that this is just, sorry. Sorry about that. This tickly cough again. It's not the tumor, because it's right here. And this is not lung, this is just throat. So I think it's a result of the trametinib, because I know it irritates my nasal throat cavity. So anyway, but attitude. I think the closest analogy I can give you to what keeps me excited about every day is I try to live like a panda. The panda bear, the black and white bear. We've all seen them, right? Now, have you watched these animals? These animals, all right, we know bears. Bears are cunning and ruthless and vicious and powerful and apex predators, right? Well, that's most bears. Pandas are silly bears. They are silly bears. They are all about having fun. They're goofy. They're hilarious to watch. It makes me wonder how they even survive in the wild, because they're just like climbing trees and falling out of them, and they're just tumbling down hills, and it's leaning back in a chair and it tips over. I mean, they're just like little animal comedians all the time. Now, I don't try to live like that all the time. What I mean by I think that, that I feel like I'm living like a panda is I'm keeping some of that in my life. Some of the childlike part, because pandas are like kids. They act like kids. I mean, a grizzly is like, it's just stone cold, brutal, impressive, scary looking animal. A panda is not, a panda looks like a cuddly bear you just want to hold and take home with you, right? The pandas are the kids of the bear family. And that's how it feels to me. It feels like every morning I'm excited about all these little things that I have in the works. I like having stuff in the pipeline, meaning things I'm working on that are taking shape and growing. And that just tickles me every morning when I wake up. Ooh, let's see how this thing is doing, or I want to check on that. So, I'm excited to get to work and solve mysteries with my patients. I mean, that's another key reason why I've continued working and I really love my job, because I love solving mysteries together with someone who's in a lot of pain and hopefully helping them get out of pain. So the living like a panda bit, keeping some whimsy in your life, keeping some silliness in your life, doing goofy things, seeing the absurd in life and finding the humor in little things and the beauty in things, looking for all the things that we tend to just kind of skip over as we're rushing through life. That I think is how I've been keeping my sanity, is because that panda inside me it is insatiable. It's always curious. It always wants to know, why does that thing work that way? Why couldn't it be better? Look at this silly thing I saw over here. Isn't it funny how this works? That's the closest I can get right now to describing what my mood is. And of course, there's a place for sensibleness and rational thinking and critical thinking and all that stuff, right? So it's not just, you're tumbling through life willy-nilly and, paying no attention to responsibilities. It's not that. So I definitely have my responsibilities. But the whimsy is definitely a part of everyday life for me. The curiosity, the wonder, the excitement, every morning it's just like it's brimming with opportunity. It's like, what's going to happen today? And which is how kids feel. I know I've mentioned this before. I mentioned it feels childlike. And children tend to be happy and joyful. And children like to play. And if you keep some play in your life, it's really hard to get depressed once you're done playing. Playing is fun, and for me it's, different kinds of play. Some of it's physical play, some of it's watching humor or listening to humor, some of it's creating stuff, being creative, coming up with things that I hadn't thought of before, or fleshing them out in my mind. So just exploring all the little rabbit trails that your mind comes up with, explore them a little bit and see that I'm telling you what I do. I just say, hey, is there something interesting if I get on this path? Oh, that looks interesting. I didn't know that. And that takes me down another path. So following my curiosity is a big part of it. And fun. I'm a big fan of fun. Who isn't? Fun, it's fun and happiness go together. So there is fun to be had, even if you do have this kind of overlying, issue going on that, hey, could be an existential thing. But to me, it just makes the importance of fun and whimsy and curiosity and exploration even more important, because how else would you want to spend your last days if you knew that that's what it was? I wouldn't want to be just, stewing in my misery and my depression and just meditating on how bad things are. That's no fun. That's no fun. So I'm not ignoring those things. But the play and the playfulness, the curiosity, the experimentation, those are things that keep my mind active and excited and creative. So that's the best answer I can give you guys right now. So this is going to be kind of a short update. I'm not sure when new ones are going to come. Any new important thing that happens, of course, I'll let you guys know. But at this point, I've been in the trial for 2 months. The first 2 cycles, they call each month a cycle, are when they do most of the testing and they're checking for side effects and they're saying, hey, I got my vision checked, I got my heart checked again, all these things. But once I figured out, you know what, it seems to be doing all right on this dose, then the labs and all the doctor's visits drop off a cliff. So it's a lot less frequent. I still stay in touch with them through an app on my phone that they use to let me report symptoms, which is actually very handy. It also gives me a list of all my upcoming appointments. So I think February 6th, I think, is my next lab of some kind. I'm not even sure what it is. So I get some extra free time, and I plan on using that to do some Panda stuff. So hopefully you guys find some Panda fun games in your life as well. Look for them. They're there. They are there. The fun is still there. We miss it as we get old and adults. Like Peter Pan, you know, have a Peter Pan mentality a little bit. You got to be responsible too. But I'll encourage you to look for that. Love you guys. Thank you so much for all of your love and support and your prayers. I can't thank you enough. You mean so much to me. Even though I haven't had a chance to meet all of you guys, I would love that. I would love that. You guys have a great weekend. Stay warm. I know it's very cold in many places where you are today. I think it's going to be 50 degrees. Yesterday was 75. But the day before was like 19. So we're all over the place here in Central Texas. But I'm liking it. It's a beautiful sunny day out there. I hope you have a lovely weekend as well. Talk to you soon.